let's say it's a very acute phase of care for a bicep tendonitis or tendinosis. The unfortunate aspect is that there are times where if tissue is degenerated, where we now have a chronic injury. Let's just go off of chronic for a second. Let's say that this is a chronic injury of bicep tendonitis. You unfortunately have to make the symptoms get worse for a moment before they're going to get better. Meaning, you've got to get some new blood flow to that area to get the tissue to accept blood better. That's unfortunately just how it works, is that degenerated tissue that has not been worked on does not produce the same amount of force, does not produce the same amount of output when you're trying to ask it to do something. And then that's why you, for some odd reason, feel fatigued. You're going to get some trigger points in different body parts. So one of our methods that we can use in our chiropractic office is we use dry needling, sometimes with stimulation, electrical stimulation, sometimes without. For today, we're just going to show, we're going to draw out the area that we would get into. This is not exactly how I would normally be sitting at the table, but for the recording sake of it, we palpate. If you need to, you have to make a little fist, give me a little contraction, and you find that bicep head and relax. And you just, I'm going to just outline a few spots. Now, I also want to go in and feel for that intertubular groove, that's that term, and it's right up there, and comes down right there. So, both palpation, sometimes a muscular contraction to feel that bicep again, and just make sure you're on the right points. And luckily the patient will tell you, yeah, you're on it. There are ways to do this where you can go directly in, or when I go directly into the tissue. There are times where I like to go and make that needle go through multiple portions of that at the same time. We'll show just one needle for the time being. If we know that the muscles are going this way, I'm going to thread as much of that bicep as I can to get up underneath the deltoid and hit into bicep and apply one needle for now. Again, you could do up the chain. There are other ways to needle, of course, but this is one of our methods to actually get that tissue or that needle some attention, both via the nervous system as well as an irritation of the needle itself, creating a microtrauma, which then elicits new blood flow and getting it back to getting some new blood flow, new oxygen, and it's a great way to treat. Again, currently we have one needle in there. For the sake of this, we're just doing the one.